Hello, I'm Dr. Dattoli. Are you facing the challenge of prostate cancer? If so, like thousands of men before you, you're searching for answers. Is it curable? Will I survive? What treatment options do I have?
Extensive research in this field of medicine has led to great advances in treatment and cure. I'm Dr. Ceres at the Dattoli Cancer Center, and we offer a greater chance for cure than prostate cancer patients ever thought possible.
The good news is that patients who enter our program have enjoyed a survival rate of greater than 90% for over 10 years. I've been performing prostate brachytherapy since the mid-1980s and continue to follow my patients from New York City. They are doing just fine, and so I have every reason to believe that the vast majority of patients will be cured of this disease. Meanwhile, the incidence of incontinence is rare, and the chances of potency preservation surpasses all other potential definitive therapies.
We believe we can help you. Come with us and see how.
The Dattoli Cancer Center and Brachytherapy Research Institute serves as one of the world's foremost research institutes in the treatment of prostate cancer, using an individualized combination of therapies, including IMRT radiation therapy and brachytherapy, the technique of implanting radiation seeds directly into the prostate and surrounding tissues. The Dattoli program of blending modern transperineal seeding with sophisticated beam radiation in the treatment of prostate cancer is the largest and most long-standing of its kind in the world. In past years, men who developed prostate cancer had few options. Radical surgery or prostatectomy was considered the gold standard treatment for early-stage cases. But for many patients, surgery brings with it serious consequences. Surgically removing the prostate almost always ends in some degree of impotence and incontinence. As this animation shows, the prostate is located right in the middle of other vital organs: the bladder, the rectum, and other tissue-like nerve endings which control penile erection. When the prostate is surgically removed, these nerve endings are almost always damaged. According to a Harvard study, nearly 88% of men who undergo radical prostatectomy become impotent. Then there's the issue of the urethra and its location. The urethra runs right through the prostate as it carries urine from the bladder. When removing the prostate, unfortunately, the urethra must be severed. After the prostate is cut out, the urethra is sutured at the sphincter. Nearly 100% of the time, urine leakage is unavoidable and some level of incontinence results. Most men must wear a diaper for the rest of their lives for fear of leakage when they cough, sneeze, or lift something. Others experience complete loss of urinary control. Impotence and incontinence, very unpleasant prospects for most men. In addition to surgery, traditional radiation therapy was another option of the past. The older equipment used for radiation frequently caused damage to neighboring tissues of the rectum and bladder. Regrettably, some of this broad beam equipment is still in use today. Early-stage cancers treated with both radical prostatectomy and conventional external beam radiation therapy were thought to have a 90% cure rate, now confirmed to be 50 to 70% at best. Recent advancements in widespread PSA testing has transformed the entire field of prostate cancer therapy by enabling doctors to diagnose the patient earlier in the progression of the cancer and more accurately predict the cure rates for every type of treatment. Over a decade ago, Don Kaltenbach, Executive Director of the Dattoli Cancer Center, faced the challenge of what to do about his own prostate cancer.
I was diagnosed with prostate cancer at age 44. I started from ground zero. At that time, I didn't even know what the prostate was. I did my due diligence, I did the research, I got second opinions. And in the end, I made a decision that I believe saved my life. I had radioactive seed implants. Today, I am cancer-free with no negative side effects.
In the 1970s, radioactive seed implantation, or brachytherapy, began as an investigational technique using crude methods. Dr. Dattoli was on the ground floor of this developing technology, being one of the pioneers of modern prostate brachytherapy in the mid-80s. What is brachytherapy? Simply defined, brachytherapy is the technique of implanting radiation sources directly into the tumor. In the Dattoli program, palladium-103 theraseeds are used as the radiation source.
Brachytherapy as the sole treatment modality is being replaced by individually designed combination therapy, such as sophisticated external beam radiation coupled with brachytherapy. For intermediate or advanced stage tumors, this combination therapy may include special hormone treatment, including potency-preserving agents. Our pinpoint-focused external beam radiation is called intensity-modulated radiation therapy, or IMRT.
When a patient arrives at the Dattoli Cancer Center in Sarasota, Florida, he moves through a well-orchestrated program. It begins with individual consultation and thorough testing to verify and grade his cancer. Doctors will perform highly sensitive scans and tests to determine the exact nature of the tumor and to learn if the cancer has spread to any other areas of the body. In cancers confined to the prostate and surrounding region, the Dattoli Cancer Center utilizes three-dimensional color flow Doppler ultrasound to most precisely image the cancer. A typical Dattoli Cancer Center patient will begin his therapy with 4 to 5 weeks of IMRT, the most advanced beam technology available. The Dattoli Cancer Center is the first private facility in America to offer it to patients. IMRT is also referred to as smart beam technology because of its extraordinary ability to cast thousands of precisely targeted radiation beamlets on a 360-degree radius directly into the tumor itself, while avoiding the patient's healthy surrounding tissue. Numerous recent studies have already demonstrated the superiority of IMRT over 3D conformal radiation.
During this procedure, strict immobilization is required and a special B-mode acquisition and targeting system, or BAT, is utilized. This is done moments before each treatment to ensure that the organs are exactly positioned for the IMRT beamlets.
Treatments take only about 15 minutes a day. This 4 to 5 week external beam therapy is followed by a 1 to 8 week break period, and then the seed implant is performed. A precise seeding map is designed for each patient, dictated by the size of the prostate and the size and location of the tumor. The Dattoli Cancer Center has further refined the mapping technique with the use of real-time imaging, using transrectal ultrasound and CT scans. With these technological improvements, a more precise three-dimensional reconstruction of the prostate can be generated, and the seeds can be more accurately placed where they will do the most good. The radioactive seeds are dispensed using hollow needles, which are inserted through the perineum, the area between the scrotum and the anus. A template, or grid, is used to precisely guide the placement of the needles. The seeds are tiny, less than a 1/4 inch long and about the size of a mechanical pencil lead. The goal has been to target and destroy the cancer with minimal exposure to surrounding tissue and organs. The computerized guidance system helps determine where the seeds should go and how deeply they should be inserted. No surgery is performed and no knives are used. Dattoli patients will tell you that their experience is surprisingly easy. The brachytherapy seed implantation performed at Sarasota Memorial Hospital on an outpatient basis requires only a local or general anesthetic. The patient is up and walking usually within 45 minutes. Back at the center the following day, a special helical CT scan is performed to confirm seed positioning and determine the need for any additional radiation treatments. The patient is then free to go home. He'll return to the Dattoli Center within 3 months and then biannually or annually for checkups. Patients enjoy a warm and caring environment during their stay in Sarasota. The Dattoli Cancer Center makes you feel more like you're in an upscale health club or a luxury hotel rather than a cancer treatment facility. The furnishings and ambiance are first class. The professional staff assists with finding living accommodations, filing insurance claims, and the online help desk is always available to answer questions discreetly.
Thank you, Mr. Johnson, for holding. You were asking about diet as far as during the implant process.
A unique feature is the Tuesday night group gathering sponsored by the Dattoli Cancer Foundation. These programs focus on a discussion topic and, in addition, allow experienced patients to pass on support and encouragement to newcomers in a casual setting. Sarasota is a wonderful place to stay during the treatment cycle. International airports in Tampa, Fort Myers, and Sarasota make for easy access. Interstate 75 passes through the county and connects with other major Florida cities. This resort city on Florida's west coast has excellent weather year-round and offers an abundance of affordable accommodations and fine restaurants, as well as beaches, golf courses, shopping, and entertainment. In fact, Sarasota is renowned as the cultural center on Florida's Gulf Coast, with every artistic discipline well represented. Weekend visits to local attractions and trips to destinations like Disney World, Cape Canaveral, and Sanibel Island are also popular. For many patients, this relaxed and culturally rich environment is important for their wives, family, or friends who come with them to offer love and support. What are the chances for survival after brachytherapy treatment? Dr. Dattoli comments.
The now greater than 10-year survival rate for patients who have completed our brachytherapy protocols is, in my opinion, superior to surgical removal of the prostate. The biggest difference is in the quality of life after treatment, with far fewer incidents of impotence and incontinence.
The positive influence and reputation of the Dattoli Cancer Center is spreading worldwide. Patients coming to the center for their prostate cancer therapy from the United States and Canada are increasingly being joined by patients from European, Asian, and South American countries. Testimonials from satisfied patients are profuse in their praise. Another distinguishing aspect of the Dattoli Cancer Center is the contribution of its nonprofit foundation. Jenya Carnahan directs the foundation activities.
The Dattoli Cancer Foundation is a charitable, not-for-profit organization whose mission is to raise awareness of the widespread incidence of prostate cancer and the need for early and annual screening exams. The foundation provides information and advice to newly diagnosed prostate cancer patients and their spouses, and works to support research into better methods of diagnosing and treating the disease. Its main focus is to give patients direction and hope in their personal journeys to survival. The Dattoli Cancer Foundation is funded by donations from patients, vendors, and other entities interested in prostate cancer.
The Dattoli Cancer Center is a world-class facility with a world-class professional staff, compassionately dedicated to your utmost care and recovery. The Dattoli team stands ready to ensure that your individual treatment experience is a highly positive one.
Curing your disease and protecting your quality of life is our goal. We look forward to helping you.
The Dattoli Cancer Center welcomes your inquiries. Please feel free to call for information and an appointment time to discuss your care.